Sandra Spencer.
Hello, everybody. This is Sandra Spencer, and I'm from the National Federation of Families for Children's Mental Health. And I'm being joined today by Joy Spencer, who is my daughter, who will be presenting with me. And we would also like to say that this webinar is brought to you through our partnership with the Technical Assistance Network for Children's Behavioral Health, and we're one of the key partners with the TA network. So we're going to get started, and we thank so many of you for joining us today. So let's talk about why we should even be involved in policy work. And we all know that policy makes a huge difference in everything we do. Policy really does impact the way mental health services are provided, which also impacts overall mental health. So it's so important for us to see policy as an opportunity for us to get our voices heard, to express our needs, and to make sure that everyone knows about children's mental health and what they can do to improve services. So communicating with policymakers is what we're going to be talking about today. And we're really going to talk about 3 ways in which we do communicate with our policymakers. Number 1 is educating. We all do that on a regular basis. Every time we're having a conversation, talk to somebody about children's mental health, sharing our story, tell people what we do, talking about current events, we are in essence educating people about mental health. But the next level is advocating. And this is when you are really trying to take action. You're really talking about a cause, you're talking about something you believe in, you're talking to individuals or organizations because you want support or you want some type of action to occur. So you're using your voice to make change happen. And then the third level is lobbying. And this is a communication with legislators intended to really influence a specific legislation. And we will get into a lot more details around that as we go on in the webinar. So as you can see from this diagram, educating, advocacy, and lobbying, they can sometimes get intermingled. So every time you're communicating with people, talking about your issues, you're educating. So I think educating is what we do every day. But then you can get into advocacy, and our advocacy is educating, although our educating may not necessarily be advocacy. And so we're going to talk about that in more detail. And then it's lobbying. And there are some very strict guidelines around lobbying and some things that everyone needs to be real careful about when we talk about lobbying. So most of our attention today is going to be focused on advocacy and lobbying.
So I'm sure that all of us here on the phone are already great advocates for mental health, whether we know it or not. So let's talk a little bit about what constitutes as advocacy. Advocacy is discussing a broad social issue, whether you're discussing that with your family, your friends, members in your community, your elected officials, or other policymakers. Anytime you are presenting facts about a particular issue or even writing or issuing a response or a request for information, responding to a request for information where you're presenting facts about a certain issue, you are advocating. So let's talk about a way to be an effective advocate and ensuring that our voices are heard and that we are influencing positive change. We're going to talk about setting an advocacy agenda. The first step in setting your advocacy agenda is going to be outlining your goal. What is your mission and vision? What would you like to see as a result of your advocacy? For example, the National Federation's mission is trifold. We aim to provide advocacy, provide leadership and technical assistance, and also collaborate with family-run and other child-serving organizations to transform mental health. This year, we're going to focus a lot on this collaboration piece. We want to focus on bridging the gap in available mental health services and support by collaborating and integration across systems. We want to see juvenile justice working with the mental health system, working with child welfare, and working with education so that everyone is on the same page when it comes to reaching overall goals centered around mental wellness. So the second step in setting your advocacy agenda, after you have your goals, you need to decide what your priority issues will be. For example, the National Federation always focuses on supporting families and family-run organizations, securing funding for children's mental health services, eliminating harmful seclusion and restraint practices in schools. As I mentioned before, we're going to focus on integrated care across systems, increasing access to education, and eliminating stigma. It's not a bad idea to think about prioritizing issues that are already receiving a lot of attention. We do understand that your issues are going to be more personal. They're going to relate to you, your family, your community, or your state. But now may be a good time to prioritize issues that deal with, for example, you may want to advocate for increased police training when they're dealing with children and youth who have mental health challenges. Or you may want to take this time to advocate for true parity when it comes to the mental health services you receive through Medicaid or your private insurance company. During this step, it's going to be very important for you to research, do a little background research, and come up with facts and policies that are already related to your priority issues. This is going to help you as you reach out to your policymakers, and it will ensure that you have a clear and concise message for communicating with them. So the third step in creating your advocacy agenda is going to be determining your methods for advancing that agenda. You may decide to focus on legislation, so you would be concentrating on speaking with legislators about supporting specific pieces of legislation that support particular mental health programs. You may decide to advocate by joining a coalition or an advisory board that gives you access to policymakers so that you can communicate your solutions to them on a consistent basis. Or you may decide to coordinate advocacy events in your community to educate your community members and create awareness about the need for community mental health programs. Those are a couple of examples about how you can set an advocacy agenda to become an effective advocate. So now we're going to talk about how you can take your advocacy to the next level and begin to lobby.
So hello everybody. I'm going to talk to you a little bit about lobbying. And there's two different types of lobbying. One is direct lobbying. Direct lobbying is direct communications with policymakers. And this is when you are really trying to influence a particular outcome or legislation. This direct lobbying is very important because you are really trying to get something done. The second type of lobbying is called grassroots or indirect lobbying. This is your attempt to influence legislators and to make an appeal. Most of these things come when you're really talking to a group of family members, a group of legislators where you're really going to say, this is a piece of legislation that I really want you to vote on. This is a specific action I want you to take. This is what I want you to make phone calls about. You're really, really being specific. You have a legislation, you have that legislation number, and you are really trying to get your point across. So there's a really, really distinct differences in your lobbying. And so you see a graph that I have, and this shows you the guidelines for lobbying. It shows you how much money you can spend on lobbying according to what your annual budget is. So if you look up here, you'll see that if, say, for example, your budget is up to $500,000, there's a permissible amount that you can use in expenditures. And you have to be really, really careful because expenditures include everything related to your lobbying efforts. That means your travel, your hotel. If you are not in the Washington, D.C. area and you come to do specific lobbying, you have to include your traveling expenses. And then you also have to remember what I talked about in your indirect lobbying. So if before you came to D.C. to do some direct lobbying, you sent out mailings, you made phone calls, you contacted people through your listserv, all of this has to be calculated and put into your lobbying expenses. So it's very important that you check your government websites, especially in your states and in your counties, to find out what their rules and regulations are around lobbying and how much money you can actually expend in lobbying. So a lot of you, if you are a 501c3 organization and you've gotten that tax status, you were probably asked to fill this out for the IRS. And this is where you had to declare whether or not you were going to be a lobbying organization, and you had to have this on file. The National Federation, we do not opt to classify ourselves as a lobbying organization, and so we make sure that the work that we do stays in the realm of advocacy and education, because it's a really strict policy, and they really do monitor this. Most of the time, I found that they don't look into it closely until there's a real issue where you're really doing some hardcore lobbying. So you really have to be careful if you declare your lobbying to stay within your funded amount, and then you also have to make sure that you declare yourself as a lobbying organization.
So I want to say one more thing about lobbying really quick. We do want you guys to realize that this really applies to organizations or programs that use federal and state dollars. We do want you to remember that you can certainly lobby as a private citizen on your own private time. You may not be able to lobby when you're wearing the hat as an employee of a nonprofit organization, but always take advantage of your right as a private citizen to lobby and advise people on which pieces of legislation and policies are best for your family and your child. So now that we know the differences between educating, advocating, and lobbying, we're ready to speak with our policymakers. Who are our policymakers? Policymakers include anyone who makes decisions about law and policy. We're not just talking about government here. We're also talking about organizations and institutions. Every organization has a policy-making structure. So we're talking about staff, we're talking about employers, we're talking about judges, we're talking about state administrators. Make sure we keep this in mind. Sandra's going to tell us a little bit about who our federal policymakers are.
So one thing to know about federal policymakers. Federal policymakers are your state representatives, your senators. They can be heads of department and of agencies, federal departments like the United States Department of Health and Human Services, SAMHSA, which is the Substance Abuse Mental Health Services Administration. So when we're talking about federal policymakers, we're talking about agencies that make federal laws pertaining to confidentiality, access to services, constitutional rights and rights violations, regulations, federal budgets. We're talking about all of those things when we talk about who our policymakers are and what kind of federal policies. There's also policymakers that are national associations, advocacy groups, coalitions, advisory councils. So the National Federation, we are one of those kind of national advocacy organizations. And although we do a lot of advocacy and education to these federal agencies, people do advocacy to the Federation as well. We get calls from communities, from families, from citizens that tell us about something that may be happening on a national scale that they want us to advocate about. And so sometimes we write letters, we sign on to letters, we do many different things. So it's also important that when you talk about federal policymakers, yes, you are talking about your senators and your representatives and their staff, but you can also be talking about agencies and national organizations. So if you want to talk with some of your federal policymakers, especially your senators, your legislators, you may also have an opportunity to talk to their staff, their staffers. I just wanted to put a plug in. If you make an appointment or make a phone call to one of your federal legislators and you get their staffers, that is not a bad thing, because they have staffers who are specifically assigned to either health issues or mental health issues. And their staffers could be just as important as talking to them directly, because they're going to brief their staffers on a regular basis. Those legislators want to know what their constituents are talking about, what's important to their constituents, and those staffers will be the ones who will follow up, who will get your calls out there, and they're the ones that you probably will have more success following up with. So don't ever get disappointed if you get the staffers. One thing that I wanted to talk to you about with federal legislation is every time there's a law that's passed, federal agencies get assigned to implement those laws. And one of the things that they have to do when they implement those laws is they have to set regulations and guidelines. And a part of setting those regulations and guidelines for whatever they're implementing, they usually have to send those guidelines out for public view and for public comment. So I'm giving you a live example of a way that you can have your voice heard, do a little bit of advocacy. Right now, SAMHSA, which is the Substance Abuse Mental Health Services Administration, is asking for public comment on some criteria that they have just written for certified community behavioral health care clinics. So these clinics are going to be established across the country, and this is your opportunity to go to these links and give some public comment, to use your advocacy voice. The National Federation has already given several comments. We've been involved in conference calls with SAMHSA and other federal agencies about this. And some of the things that we've already started to say to them is we want to make sure that these certified community behavioral health clinics listen to the voices of youth and families around their treatment. We also wanted to make sure that these health clinics take advantage of peer support. That's youth peer support and family peer support. So this is a great opportunity. Now, this open comment session is only open until February 16th. So you have a little less than a week to log on and give your opinion. One of the things to remember, that there are not a lot of advocates out there advocating on behalf of children's mental health. So the more that you do this, take advantage of these opportunities, the better it sets us up for really having an impact to make change. So I would ask you to let this be a teachable moment and take the opportunity to give public comment on this federal legislation.
So if you have an issue pertaining to a state law, that may be a concern about state mental health programs, your state Medicaid programs, your state's child custody laws, your state's juvenile justice laws, it'd be best to reach out to your state policymakers. Your governor has the chief executive power in your state, so they hold the power and authority to make and veto laws. If you have an issue surrounding state laws, you may also want to reach out to your state legislators. So that is your state's General Assembly, the Senate branch or the House branch in your state. Those are going to be some very important policy makers to contact if you have an issue regarding state law. Other important policy makers are going to be your state's judicial branch, directors of statewide programs, members of statewide coalitions and advisory boards, and also department heads and state administrators. Just like the federal level, state agencies are going to be the ones who determine guidelines and regulations for implementing laws. So if you have a concern about a law concerning Americans with disabilities or mental health challenges, you may want to reach out to your state mental health department. If you are having issues with cultural competency in your state, you may want to reach out to the department or agency that deals with cultural resources. This slide just shows a few examples of state agencies, mostly from New York and North Carolina, but each state will have an agency to address particular needs. If you have an issue that deals with maybe your child or your child's school, or even issues concerning local community programs or a budget for that program, or even neighborhood safety, you may want to consider contacting your local policymakers. The mayor and the city council, or the county commissioner combined, are the entities that hold the chief executive power in your city, tribe, or local municipality. They are going to be the ones that you would contact about maybe issues around local budgets or local and regional laws. Even issues concerning bullying in schools or general injustices in your community. You may also want to consider reaching out to your school board superintendent, reaching out to the school's principal, reaching out to judges or deans at your local college or university. As we hinted on a little before, community advocacy organizations are also great people to reach out to during your advocacy. Community advocacy organizations are also great for partnering, so you may want to reach out to an organization to partner with you to contact other local policymakers. For example, you may want to reach out to a faith-based organization to approach your city's council or mayor with a particular issue. We also want you to keep in mind that reaching out to local media is a very effective method. A lot of people on the local level pay attention to their local newspapers and their local news stations, so never underestimate the power of reaching out to local media. We want everyone to remember when communicating with policymakers that our goal is to form relationships. Positive relationships are really going to enhance your advocacy efforts. Policymakers are more likely to accept and sustain programs when they're familiar with the outcomes. We want everyone to aim to be the person that their policymaker thinks of to call when they need more information about an issue that concerns their community or an issue that they've been advocating about. We must remember that policymakers are people too, and people tend to listen to more to those that they know, like, and trust. Now we're going to talk a little bit about ways to communicate with your policymaker.
So it is so important when you communicate that you make sure you're using the best, most effective method. So we're going to talk to you about 3 ways that you can really communicate, and one is face-to-face visits, of course. You can do letters and emails, and you can do phone calls. So most policymakers, especially your legislators, are really, really wanting to know what their constituents think. And they make sure that they track letters and that they track phone calls from their constituents. So you want to make sure that you take the action and make sure that you communicate with your legislators. So I'm going to talk to you a little bit about face-to-face meetings, and this is just so important. When you have an opportunity to talk to any policymaker, whether it's on the federal, state, or local level, there are some things you have to keep in mind. First, to be brief, clear, and specific, to know exactly why you asked for that visit, and to make sure that you have your talking points, your elevator speech all ready to go. When you get into your appointment, you want to make sure that your opening remarks grab their attention. You want to introduce yourself as a constituent or as a person who cares about something that they have some influence over, and you want to make sure you share your story. Then you want to define the need, make it relevant to you, your community, and what you know impacts them in their community. You need to ask for their support for a specific program, or ask for some type of specific action or something you want them to do. And then in closing, you need to make sure that you thank them for their time. So if I were going to visit one of my state policymakers here in the state of Maryland where I am, and because of my life experience, I would go to them and I would say right away, did you know that 1 in 5 children in America has a diagnosed with mental health issue, and that's the same for here in Maryland. and I'm a parent and I have a child with serious mental illnesses, and I need you to really help me deal with some school issues because my child is constantly being suspended from school for behavior that's directly related to his mental health issue. And then I would have an ask for that person. I would say something like, there's been a lot of talk around how to make changes within our schools, and so if you could really support any of the legislation that's coming out around mental health in schools, it would be greatly appreciated. And then in closing, I would say that mental health is important to overall health and well-being, and if we could really make sure that we're supporting programs that help children with mental health issues, like the Children for Mental Health Education Act, it would really be important. So you just have to make sure that you talk about what's important to you, what's important to them, and then give them a little bit of data. So you make sure when you do your face-to-face meeting that you rehearse, you know exactly what you're going to say, and that you're ready for any questions that they may ask you.
So writing letters are a very effective way to introduce an issue, or even a very effective way to follow up with your policymakers. So here I just have a little outline about how you would write a letter to a policymaker. In the first paragraph, you would outline your issue, introduce yourself, and state the position that you would like your policymaker to take on the issue. Please note that numbers 1 and 2 are interchangeable here. It'll be up to you to try to make a judgment about what would be most effective. You may want to introduce yourself first, but outlining the issue first is a perfect way to grab your policymaker's attention. For example, we got a call here at the National Federation office one day from a school psychologist. As soon as we answered the phone, the first thing he said was, there were 3 suicides in 2 weeks at my school. And that really got our attention. We were really interested in listening to what he had to say. He then proceeded to introduce himself as a school psychologist, and then he presented his ask. He wanted us to provide him with resources that would help with suicide prevention and help them be able to identify some of the signs and symptoms of suicidal ideation. So that was a very effective method for him, outlining the issue first. In the second paragraph, it's important to present data and research and even share personal stories that support those facts. In the third paragraph, it's good to repeat your ask or the action that you want your policymaker to take, and then always make sure that you thank them for their time. The image you see on this slide is just to show how short and precise a letter to your policymaker should be. It's not particularly a good idea to have a really long letter because then they may not read the whole thing. And we also want to make sure that we're being really clear and concise. So presenting facts and trying to keep emotion at a minimum. We really don't want to sound too aggressive or angry because we don't want to have our letter dismissed before our request is even given a chance. I see we have a question here. How many letters does it take to make a difference? So that's actually a good question and a point that I was going to bring up. When writing letters or emails, it's important to be patient and waiting for a follow-up. A lot of our policymakers' offices are really busy, so it may take a while for them to respond, but it is definitely well worth the effort, especially for elected officials, officials that are voted in by the public. They definitely track how many letters that they get on particular issues, and that helps them determine what issues to act on. Another good strategy to use when writing letters and emails is to get other people to sign on to that letter with you. So you may get other family members or other organizations to add a statement saying, yes, I support this letter as well. Emails, if you have an urgent or a time-sensitive issue, an email is the way that you would like to go, keeping in mind that we have had a lot of heightened security lately. So it may take 4 to 6 weeks for a letter to even reach your policymaker's office if you are sending it through regular U.S. Postal Services. I do not have an answer on a finite number, but I do know that letters count, that they are tracked, and that they are a very important advocacy tool. So another good way to advocate for particular issues is by making phone calls. This is a good way to schedule appointments or even follow up on information or previous issues that you brought to your policymaker's attention. Here are some sample scripts you can use when calling your policymaker. If you are calling a legislator or an elected official, it's very important for you to introduce yourself as a constituent of that legislator's district so that they know that their decisions are affecting you, your community, and your family, and so that they also know that you have a say-so in the position that they hold. You can vote them in and out of office. When you're speaking with other policymakers or key stakeholders, it's just very important for you to remember to introduce yourself, tell a little bit about why this issue is so important to you, and outline specifically what they can do to resolve the issue or address the issue. One of the most important pieces of your advocacy is the ask. You have to make sure you are asking your policymaker to do something specific. This gives you tools for follow-up, and it also gives you a finite talking point when you're speaking with your legislator. So if you're advocating on the federal level, you may want to ask, will you support this piece of legislation that increases community mental health centers or that puts mental health programs in schools? On the state level, you may decide to ask your state Medicaid director, will you join our efforts to include peer support services as a Medicaid billable service? You may want to expand on how peer support has personally helped you or your family. If you're speaking with a local policymaker, you may want to, for example, ask your mayor, will you consider implementing training programs for police officers, for teachers on trauma and trauma-informed care when they're dealing with youth and children who have mental health challenges? Very, very important to make sure you ask your policymaker to do something specific.
So we're going to go over with you a list of some really good tools and strategies for you to use. And some of these tools and strategies you can use when you're doing big state-level things or when you're doing local things. So one strategy that I hope you all know about that the Federation has been using for many years to educate not only our legislators and policymakers, but to educate the public in general is our Children's Mental Health Awareness Week. And we have really grown to be able to use this as an awareness and education tool, but also we've really been able to use this as a huge advocacy tool. So we use this opportunity to encourage people to reach out to their policymakers during the whole week of Children's Mental Health Awareness Week. And all over the country, our Federation chapters, members of the community, they're doing state legislative office visits in their home states. They're visiting their mayor's offices. They're visiting their school boards, their local school districts, and they're giving out information and fact sheets. We also have a Green Ribbon campaign. We have Green Ribbon that we distribute and sell all over the country that says Children's Mental Health Matters. And every year that increases. We sell hundreds of thousands of Green Ribbon that people use as an advocacy and education tool. Some of our states, as a matter of fact, most of our states through our state federation chapters are also getting proclamations from their governors and from their mayors proclaiming that the first week of May is Children's Mental Health Awareness Week. And so we get that all over the country where we get that declaration. So this year, Children's Mental Health Awareness Week is May 3rd through the 9th. And so this is another opportunity you're going to have to not only use it as an education tool, but take advantage of some of your advocacy opportunities to talk to your local and your state government and policymakers. And remember, this is your judges, your school boards, your superintendents, your city councils. There are a lot of people who make decisions that impact children, youth, and families. So as you can see, our theme for this year is mental health is fundamental. And Joe, I'm going to let you say a little bit more about that.
Yeah, I just wanted to note how we made our Children's Mental Health Awareness Week theme directly aligned with our advocacy agenda. So with this theme, we're going to be talking about how mental health is essential to overall health and how mental health should be included in every public health conversation. So this is going to be achieved through system collaboration and making sure that mental health is at every step of our healthcare treatment. So that's an example of how you can tie in some of your advocacy priorities into an awareness campaign.
Okay, so I'm going to give you a couple of more tools and strategies because we know that we need practical, everyday how-tos in order to go out here and do some of our advocacy work. And sometimes we realize that some of the things that we are doing already are advocacy tools. So number one is to vote. That's something that all of us can do every time we have opportunities to go to the polls and to vote. Distribute promotional items with your contact information on it. We realize that when we go visit any office, if we do any kind of local or statewide or national initiative, giving people something in their hand to remember our cause is very important. Whenever you have the opportunity, please attend town hall meetings in your community because even if they're not on a specific issue of mental health and children's mental health, you best believe that mental health crosses every boundary and it can be involved in every conversation. So also give feedback. We have a lot of radio and media opportunities to call in to radio shows, to call in with information, to give comment. And that's something we use here at the National Federation. I know the National Public Radio, I've been on several times to talk about issues, most recently with all of the incidents that's been happening around the country. I've been able to talk on National Public Radio about how police officers need more training and how to deal and de-escalate issues instead of escalating them. Do things like blogs and use your social media outlet. You know, get active on Twitter, get active on Facebook. You know, make sure you're using your message and your advocacy voice in those social media realms. Invite policymakers to visit your organization, especially if some of you on here are funded system of care grantees. Invite your policymakers to come out and see your program, to see what you're doing to make life better for children, youth, and families. If you're running or working with a family-run organization, I would make sure that, especially during Children's Mental Health Awareness Week, have activities and invite people from the school board, from the mayor's office. Make sure that people know who you are and what you're doing. One of the ways to get them there, if you want to have your mayor, somebody from the city council or school board, give them a special award, give them some type of recognition, then they will come out. And that's your opportunity to advocate and to educate. Write op-ed pieces, write letters to your newspaper, write editorials, get your information out there. Thank policymakers publicly. If they've done something in your community, if they made comments about mental health in your community, thank them, acknowledge them, and then offer training whenever possible. There are some times when we bring an issue to our local or state governments, they don't really know how to address our issue. So maybe you can offer, as a person who worked in the community, as a family member, as a provider of services, you could offer to give them some training that really will help and educate them about your causes. So Joy's going to talk about a few more practical tools and strategies that you can use.
One strategy, a really great strategy, is to speak with policymakers that represent your particular state or district. We know that people tend to listen more to their constituency group. So really be strategic around targeting policymakers that have authority over your area. Make sure it's a good idea to use key stakeholders such as universities or faith-based organizations or advocacy organizations as partners to engage policymakers. We all know that united voices are louder, so do not be afraid to reach out to other groups, stakeholders, and entities that have similar visions as you and partner with them in your advocacy. Focus on policymakers that seem to need the information and data you have. So if you see a state administrator or a legislator or even a principal asking for information and you know you have access to that information, reach out to them, provide them with that information. I know we have some instances where policymakers may be misinformed about a particular subject. So if you see those type of things happening, you see statements where there's some real issues with misinformation, reach out to them, provide them with facts, help eliminate that stigma, help educate them so that they can be more informed and make more accurate statements about the issue. Try speaking with the same staff person or policymaker each time. For example, if you call your legislator's office, try asking for the staffer that works on their health policy or mental health policy and form that relationship. Speaking with the same person is a very effective strategy for forming relationships and making that policymaker become familiar with you and your advocacy. Again, teaming up with local organizations with similar interests and goals are very effective. So if you know that there are other family-run organizations in your area, see what you guys can do to work together for meetings with policymakers or awareness events. Preparing and disseminating tip and fact sheets are really great tools because a lot of people, you'll be surprised how many people simply do not know the facts that we are living with every single day. I know, for example, we had a White House meeting last year. If you guys remember, there was a national conference on mental health at the White House, and we were invited to represent the family voice. And when we presented them with the fact that there are twice as many suicides per year than homicides, a lot of our government officials at the White House were surprised. That was the first time that they had heard that. So getting information out is a really, really helpful tool. You may want to conduct community-wide, statewide, or nationwide calls to action. I know this is something that we do. We send out calls to action over our listservs. And we say, look, there's an opportunity for you guys to comment on certain regulations, or there's an opportunity for you to encourage your legislator to co-sponsor this wonderful bill that includes these awesome mental health services. And it's always a good idea to join advisory boards, coalitions, and committees, because oftentimes those coalitions have already formed relationships with policymakers, and so it's a really good way for you to have your voice heard.
So we just have some questions that we want you guys to think about as you're thinking on this presentation and how you can do things in your communities. How do you mobilize your community or your state in your advocacy efforts? What would be a good way to get people really behind what you want to do? And what is an advocacy strategy that you use that works? So I'm going to give a couple of examples around something that has worked for the National Federation, and I think Joy may have other examples. But one Joy already mentioned is about us being involved in the White House Conference on Mental Health. Well, the way that I think we really got ourselves invited is whenever there's national events, that whether they're horrific national events like 9/11 or the shooting in Newtown, or whether they're really good positive events, we send out information and fact sheets to our legislators and to the White House. And so one of the things we did after the Newtown shooting was we sent out facts to families about how to talk to your children about crises. We send information and fact sheets to our legislators about the prevalence of mental illness and the importance of treatment. and we just continued to send information until we really got noticed by legislators, which in turn helped us get noticed by the White House. And so we were invited to several White House meetings. We were added to Vice President Biden's task force on gun control and improving mental health services. And so now we realize that officials in the White House and in Congress, they know who the National Federation is. And so when things happen or when they just need information, we get the phone call. And this is the way you should be in your community, in your local community, in your state. If you have a family-run organization, those legislators should know you, and they should know that if anything happens that impacts children's mental health, that you should be the one to call. Another example of how we mobilized a community many years ago, and this is always an issue, and it's an issue right now that we are still dealing with. But several years ago, we got word that the federal government's budget had cut every bit of the funding to statewide family network grants. And statewide family network grants are what funds a lot of our family-run organizations. And so we really wanted to make sure that they knew that these statewide family network grants were important, that they served families, that they offered peer support, and that they really impacted the community. And so what we did was we created a template for some green postcards. And all these green postcards was a short sentence telling legislators to not vote to cut the funding to that program. And then there was space on those green postcards for family members to specifically write a sentence or two of how that statewide family network in their particular state had impacted and helped and supported their lives. And so we sent this template out to all of our Federation chapters, whether they were a funded statewide family network or not. And we asked them to get every family in their community that they had served to fill out one of these postcards and mail it to their legislator. Not only to their legislators, we had them to mail it to SAMHSA. We had them to mail them to the Department of Health and Human Services. So we sent green postcards out, and we even had a contest among our chapters of who could send out the most green postcards in the span of about 2 weeks. And I want you to know that we got phone calls from the Department of Health and Human Services. We got phone calls from SAMHSA and from legislators that say, we got it, we hear you, please stop the green postcards from coming, and we will reconsider. And so we have to remember there's ways that you can mobilize the community to get behind what you're doing and to help your advocacy cause. Joy, do you have an example that we might could share that's practical?
Yeah, no, effective strategy for us has also been being members of important national coalitions. For example, we are active members of the Mental Health Liaison Group. That group has a great relationship with a lot of congressional members, as well as members of the congressional committees that deal with our budgets and things like that. So we've always been able to stay on top of legislative information through them, and we are always stronger when we sign on to issue statements and advocacy letters with the Mental Health Liaison Group. For example, we've signed on to letters for budget recommendations. We've signed on to letters both praising and proposing solutions for different issues. For example, I remember writing a letter to Disney when they really did a bad job with portraying people with mental health issues. They really heightened stigma, so we made sure we wrote a letter. There was over 100 organizations that signed on to tell Disney this is not okay. Conversely, we wrote a letter when the movie Silver Linings Playbook came out to praise them for not having all the crude associations of mental illness and linking that to violence and things like that. I know currently we are drafting a letter in support of the Mental Health in Schools Act, which will help put more mental health programs into schools. So it's been really effective for us to collaborate with other national advocacy organizations.
So as you can see, there are many, many, many ways for you to get involved with advocacy. You can join other groups. You can do advocacy on your own for your own situation. But one of the things that we, Joy and I both want to stress to everybody is never underestimate the power of telling your own story. Because what we found out time and time again, and what we hear constantly from our legislators when we visit Capitol Hill, they say the most impactful thing that we hear is when our constituents come in and tell us their story. So you have a story, whether you're a provider, whether you're a family member, whether you work within a system of care, whether you work within an agency. Everybody has a story that they can tell that really can impact what you're trying to do.
Yeah,
so
definitely.
Go ahead, Joe. I'm sorry.
I just definitely wanted to drive that point home. I speak with policymakers and legislators on a regular basis, and hands down, every time they say to us, we need to hear what is going on in our communities. We need the personal stories. So there are ways to share your story without giving out too much information. So be strategic about sharing your story, but make sure that those stories get out there, because those stories help spread the facts.
Great. Thank you so much. So we would like to know if there's any questions from you. We've seen a couple of questions. Yes, this webinar is recorded, and yes, you will be able to download it with all the slides, plus you will get the handout that we have attached to this webinar. So I saw another question about if this webinar would count toward certification hours, and I'm thinking you're talking about for parent support providers. So yes, you can make sure that you include this webinar as a part of meeting the criteria for certification. So the answer to that is yes. And so we're going to scan, and we're going to see if there are any other questions. If you have questions about our webinar or anything we said today, you can go ahead and start typing that into the chat box, and we're going to be looking for your questions. If there are any questions that I missed, Joy or Nikay, if you can point those out to me, because I know that they've been coming in all the while we've been talking.
But no, just for clarification, there should be a document in the box that says files under your chat box. That document just contains a list of some of the more common policymakers on the federal, state, and local levels, and then some of those policymakers will have a link beside them, and those links can be used to find the contact information for the policymaker that is in charge of your district or your state. So we hope that that handout will be helpful. And we'll keep skimming the chat box for questions, but I wanted to say, if you have any specific questions or maybe even requests for specific resources or even feedback on how the National Federation can help engage you in your advocacy and keep you informed on national policy, please don't hesitate to send me an email, and I will work with you to get you any information, tips, tools, and strategies that you need. So my email is listed here on this slide, jspencer@fscmh.org, or you could call that number. That is my direct line. But please, please, please send us feedback. I welcome it with open arms, and I'm more than willing to help you guys in your advocacy.
So I see a question about if you can download the copies. You will get a link to this webinar, and it will be available for replay, and I'm sure you will be able to download it to be able to watch it whenever you need to. So the Technical Assistance Network always makes these recorded webinars available to you all.
So yes, we do not need your email. You'll be able to download the PowerPoint as well as the attachment, as well as the recording of this webinar on your own time, at your leisure. You guys are so welcome.
Yes, thank you. We appreciate it.
Do we have any more questions? We have about 3 minutes.
We really, really have appreciated all of you guys joining us, and we're going to stay on this chat box for the remainder of the 3 minutes, just to make sure that we don't miss any questions. I see one. Ooh, it went so fast. Okay, how do you learn that the federal government spends money on mental health and on the IDEA fund? How do you learn? Oh, okay, so there's several federal government websites. So each one of those federal agencies that we told you about, like SAMHSA, Department of Education, Department of Justice, if you go to their websites, you can always pull down what their budgets are. So that's one way. And then we also have a link that we've shared through our listserv of the President's 2015 budget. And that whole budget tells you where funds are going, especially funds that's going to Health and Human Services and funds that are going to SAMHSA, and it even has line items. So for that specific information, if you would email us, email Joy at that email below, or email me, we can send you the last iteration of the budget. But bear in mind that this 2015 President's budget is not yet approved, but it is the budget that's been recommended. But on those federal websites, you should always be able to click on and find out where these different agencies are spending their money. And Joe, I see that you put the link on there for some of the White House releases of the 2016 budget. So you guys have that link, and then when you download this webinar, you should be able to get to that link as well.
Yeah, I would also suggest emailing me if you are not on our listserv, because we do send out that type of information as we get it. So the link I posted is actually on our website, and it kind of gives you a brief outline of the White House's proposed budget for 2016. So we send out that type of information. If you're not on our listserv, please email me, and I will put you on our listserv, especially the listservs that pertain to policy updates. As far as certificates, Ms. Phoebe, you can email me, and I will definitely work with you to get the documentation that you need that says that you were on this webinar. That's not going to be a problem. I can verify that for you.
Okay, so I see a quick question up here. It says, do you have different levels of learning? You know, some parents who will not be at this level. We do have some resources. We have a Policy 101 session that we do at our conference every year, but we can, if you email Joy, she can provide you with some of those materials that are called Policy 101, so we could do that. And then what are some businesses or organizations that donate or partner with the Federation of Families? Oh my goodness, we do partner with a lot of other agencies, and depending on what we're doing. So for example, for mental health awareness legislative briefing that we do on Capitol Hill, we partner with organizations like NAMI, Mental Health America, Bazelon Center on Law, Child and Adolescent Psychiatry Organization. So we do have a vast amount of people who partner with us. As far as people who donate to us, we have a lot of support from mental health organizations, healthcare organizations. So the list goes on and on. We're constantly reaching out for donations, for partners. Joy mentioned that we belong to the Mental Health Liaison Group, which has dozens and dozens of national advocacy groups. So, so the list goes on. And I would say to you, if you are doing this work, creating partnerships and getting donations and funders is one of the most important tasks that you could do. So I would encourage you in that. So it is after 2 o'clock. We thank most of you for joining us. We'll try to stay tuned to the chat box a little while longer, but we absolutely appreciate all of you joining the webinar. And Joe, I interrupted you. What were you going to say?
I was going to just say to Jackie Mitchell, if you would send me an email, I'll be more than willing to brainstorm some strategies with you because we are out of time. But my quick answer would be for people that don't normally agree with our agenda and don't see the importance of children's mental health, the first step is going to be educating them because most of the time it's an issue of they don't know how serious and widespread of the issue it is. But if you email me, I'll be more than happy to brainstorm with you, and we can talk about particular strategies that would work in your community.
Well, thank you guys so much for joining our webinar today. Keep in touch with us and contact us if you need more resources and more strategies. And I hope you all have a wonderful afternoon. Thank you so much for joining us.